It's a pleasure and it's an honor as well to be participating in this webinar, wherein I would try to share my understanding of Indian approach towards this particular pandemic. It may not be a governmental approach essentially, but essentially how the society in India and how our cultural moorings, especially in a way, promote this kind of approach towards the pandemic. Uh, Basically, I mean, as you're aware that India was very quick in responding to the pandemic. Major policy decision of the Prime Minister to declare the national lockdown on the 21st of March 2020, I think remained a singularly important decision, which definitely helped India halting the spread of this particular pandemic, especially in the hinterland and in the interiors of rural India, especially. This was followed by effective communication by national leaders. The Prime Minister himself has more than 4 times addressed the nation. Lockdown had saved many infections from happening. Currently, only 66,000 Indians have tested positive out of 13 lakh tests done for the corona so far. Rapid response to the pandemic has also contributed to whatever success India has achieved. Number one is the local production of N95 masks and protective gowns. I must also mention over here that the Prime Minister and the leaders in the government have been insisting repeatedly that it need not be a very structured mask as such, but even a simple piece of linen one can use as a face cover, as what we have been describing it. And therefore, popularly, people in India have been accustomed to use some kind of a piece of cloth during the hot sun, especially during the summer. And therefore, this particular habit also has come handy in use of the masks or similar face covers. We also have imported certain masks, especially the N95 mask initially. But today, in most villages also and in other urban areas, self-help groups essentially run by women have promoted the manufacturing of masks, which are homemade kind of face covers, and that has become quite a popular movement as such. Indian research institutes have started producing rapid COVID testing kits, and they are also now abundantly available, which was not the case at the initial stage. Massive scale-up of hospitals and quarantine facilities, including the Indian Railways, for example, have segregated some 20,000 of its coaches as facilities for hosting the corona patients or suspected corona patients who require to be quarantined for a while. The success indicator, if at all that is to be focused, then the minimal deaths due to COVID is one of the very significant indicator. Although, I mean, recently there is a little bit of a spurt in it, but I'm sure it will be arrested in the immediate future. We also have scaled up the supply of chloroquine and other 150 medicines, not only within India, but also whosoever required this kind of a medicine and help from India, we have extended it, including the United States and other countries as well. We have also remarkably shown our readiness of Indian vaccine production companies to undertake large-scale production of COVID vaccines when they were designed. Another important factor is the role played by and the role that is being played by Ayush Ministry, which is a dedicated ministry for traditional Indian medicinal systems, including Ayurveda, Yoga, Unani, and Siddha, and also homeopathy. And all these pathis in a way have come together. All the practitioners in these different disciplines of medical science have come together, and they are also helping the government in a very significant manner. I believe one of the most important factor to be noted over here is that even though India is a country where there are different levels of literacy and education is also perhaps not made deeper inroads into the rural areas and the tribal areas as well, I believe very significant that there isn't any kind of a mass creation of any panic or a paranoia kind of a situation. And people have looked at the situation that is emerging out of this pandemic in a very dignified manner, and they are taking all the factors into consideration, and thereafter they are taking up steps. There is some kind of a migration that is happening due to the governmental efforts of providing vehicles, including dedicated train services. It is also being regulated very remarkably, I would say. And now that the third lockdown period is about to come to a close in another 4-5 days, I'm sure the nation is preparing itself with the help of the government for opening up. And as what the Prime Minister had indicated, that we are here to protect lives, but we are also here to provide livelihood opportunities in requisite numbers to those who are likely to be facing unemployment and issues about livelihood as well. And therefore, a kind of a calibrated approach where a balance is being struck in a very planned manner, that is something which definitely one can say about the Indian approach towards the handling of the pandemic. I must also mention over here that along with the government, which is the central government at the federal level, and all the state governments and all the local self-government bodies have also very significantly contributed in the efforts to arrest the pandemic in the cities, in smaller towns, and at times even rural areas, although essentially large rural areas of India today are free from this pandemic so far. And I believe, touch wood, this situation continues, and we don't allow the cities to export this particular disease and the virus to the hinterland, to the rural areas as well. So this is something very significant about the Indian approach. As a student of social sciences, if I may say so, that while we have been insisting on all the three basic messages which the government tried to communicate to the people in a very strong manner and very aggressively, very emphatically. But there is a kind of other socio-cultural message also that we have been communicating to the people, if not very formally, but through informal conversation. We have to be sensitive towards each other. We have to understand that we are fighting against this disease and not fighting against those who are affected by this disease. And therefore, physical distance, yes, but a complete no to any kind of emotional or psychological distance.